Hey YouTube, welcome back to my channel. Today on my way to work, once again, I just kind of wanted to talk about reasons why you should not become a nurse practitioner. One reason is because of the money. Yes, a nurse practitioner gets paid pretty well, especially in the state that I'm in, but with that pay comes responsibility, a lot more responsibility. If you are working with patients in the inpatient setting or outpatient setting, you're still liable for that patient's life, whether it's managing chronic illnesses such as diabetes, hypertension, or handling acute issues such as pneumonia in the hospital. So yeah, we do get paid well, but we're also held to a higher standard or accountability than that of a bedside nurse. So if you're looking to make more money, yes, it's great. But like I said, with that pay comes greater responsibility, sometimes longer hours, more in-depth charting. You have to worry about billing, just different things that you didn't have to worry about as a bedside nurse. Another reason why you should not become a nurse practitioner is if you only want to open your own practice. I would say that the majority of states, or a lot of states, don't allow nurse practitioners to practice independently. Therefore, it's not really just your practice. It will be you and your supervising physician. So it's not really just your practice. And then along with opening up your practice comes with building your patient panel, making sure that you're getting paid for everything that you do, billing for everything. And billing is not as easy as people may think it is. Billing is to maximize your amount that you would profit. You have to actually know how to bill correctly. So you have to worry about billing, you have to worry about staff, you have to worry about keeping those patients that you're maintaining relationships with. You have to network. It's just so many things that go into owning your own practice. And when I first started as a nurse practitioner, that was my thought, that I wanted to open my own clinic. But when I started working at my first job for private practice internal medicine, I quickly realized that working or having your own clinic is so much harder than what it seems to be. So if you want to own your own practice as a nurse practitioner, hooray for you, but that shouldn't be a reason why you wanted to become a nurse practitioner. Another reason why you should not become a nurse practitioner is if you're tired of being a bedside nurse or a school nurse or a clinic nurse or whatever type of nursing you're doing. If you're tired of that, newsflash, becoming a nurse practitioner, you're still a nurse, you just have more responsibility. You're still taking care of patients, you're still charting, there's still things that will frustrate you. You're still a healthcare provider. So being a nurse practitioner versus a bedside nurse or a registered nurse is a different role, but we still face the same difficulties, such as frustrations with charting, frustrations with staffing, frustrations with patient load, frustrated with your hours. They're still the same frustrations, you're just at a different role or a different level, and your scope of practice is a little bit wider. Another reason to not become a nurse practitioner is if you don't like working with the public, don't become a nurse practitioner, because that's what we do. That's what, especially a family nurse practitioner, because our role is not only treating and managing chronic illnesses, but it's also prevention. So you do a lot of community things to prevent chronic conditions from becoming worse than they are. So if you're not a people person, if you don't like to network, if you just want to do your specific job and go home, then being a nurse practitioner is definitely not for you. Another reason why you should not become a nurse practitioner is if you are not willing to continue to learn. In my short time of practicing, I have learned that there are so many things that I do not know coming into this role. And you need to continuously educate yourself and be up to date on the most current and evidence-based treatments, and not just rely on, say, a coworker or something you read that's not evidence-based or something you learned in school. You have to continuously learn. So if you don't want to learn anymore, then you're in the wrong field. And we're required to maintain CMEs for credentialing, for licensure, for certification, and most companies pay for that, but you're still responsible for keeping up to date and staying on top of your craft, perfecting your craft. So if you don't want to learn, if you're tired of learning, you're tired of going to school, you just want to do your job and take care of your patients and go home and take orders and go home, then being a nurse practitioner is not for you. Thanks for watching.